Hi, my name is Andrew Kobets. I'm an assistant professor of neurological surgery and pediatrics at the Albert Einstein College of Medicine, and I am very excited to announce the publication with theme of the third edition of the Pediatric Neurosurgical Operative Atlas. This was work initially started by James Goodrich nearly a decade ago as a continuation of his previous second edition. This text expands substantially upon the number of chapters and the number of different procedures and pathologies that we treat as pediatric neurosurgeons. We have expanded to nearly 84 different chapters and different pathologies, and this will be an invaluable resource for any pediatric neurosurgeon, resident, or medical student trainee who is interested in these type of procedures in order to understand the different types of surgical options available for different patients, as well as the different management strategies beyond surgery that we will manage for some of our more unique pathologies and unique patients that we see. We also provide an invaluable pearls and pitfalls section in each chapter in order to provide some of the most detailed and highest level information regarding some of the nuances that some senior neurosurgeons have accumulated over the decades of their experience within this field. This work not only brings some of the newest technologies in our field towards the management of these pathologies, but also maintains a degree of legacy and of history by providing chapters from some of our great pediatric neurosurgeons in terms of how they would manage particular pathologies, namely Dr. Goodrich. We've created several continuation chapters from some of his work from the previous edition, which allows us to maintain some of the tenets and some of the ideals that he has brought into his surgical cases, even beyond his unfortunate and untimely passing. This work allows us to maintain this legacy, allows us to respect and remember those that have come before us within the field of pediatric neurosurgery, and has allowed us to understand how procedures were done in the past, how they still may be the ideal procedure for certain pathologies, and even how some pathologies have evolved with newer technologies and newer options for surgical management. We truly hope that you will enjoy and appreciate this book, that this textbook will allow you to reference the different options you have in terms of the management of some of your more complex patients and cases, and will allow you to understand how, in moving forward in the future, the field will continue to evolve as we have evolved from the second edition. So we dedicate this work most sincerely and with a warm heart for Dr. James Tate Goodrich, who conceptualized this idea, whose unfortunate and untimely passing had not allowed him to complete this work. And then we came in, Dr. Keating and I, to complete this work on his behalf, for his memory, for his legacy, and we truly hope that you will appreciate it and use it to help your patients better in the future.